Well, ahead after the break, October is Breast Cancer Awareness Month. The doctor shares some tips on things we should be doing now to be proactive in our health. October is Breast Cancer Awareness Month, and our next guest says we can do more to be proactive instead of reactive. From the diet you eat and various lifestyle factors like sleep and exercise, there are many ways we can begin being more proactive with our health. With us this morning is Dr. Julie Chen, co-founder of Wisdom and Wellness and Chief Clinical Officer of Human Longevity. Good morning, doctor.
Good morning. How are you, Elizabeth?
Great. Thanks for being with us, getting up early for us out there on the West Coast. You are all about being proactive when it comes to breast cancer. Can you explain?
Sure. So a lot of people actually think that most breast cancer cases are only genetic based, but the BRCA1 and 2 genes that we all know so much about are actually making up about less than 10% of the cases. So majority of the cases actually have other factors that impact it, like our environment, toxin exposures, other factors like radiation that may impact our genetics. So there are a lot of factors that we can actually do something about, like how we sleep, how much exercise we get, the foods we eat, and also limiting our alcohol and not drinking too much and not smoking. So there is actually a lot that we can do that can actually impact and lower our risk factors.
What are the top few things? You just mentioned a couple there, but what are the top few things that you recommend to clients?
Definitely not smoking. Smoking has been linked to so many cancers, not just breast cancer. So that's one thing that we really want patients to try to stay away from. And also diet is huge because our bodies are machines first and foremost. So what fuel we put into our body is so important in how we optimize our healing and how we prevent diseases from occurring.
What kind of foods should we be eating?
Well, so there are two folds on that. One is avoiding processed foods, because when we are eating processed foods, the chemicals actually act like hormones or chemical hormones. They're called xenoestrogens. So we want to avoid that. But then on the flip side, we want to be eating a lot of fruits and vegetables that are high in polyphenols and antioxidants that help our body heal, like cruciferous vegetables, citrus fruits, berries, fiber, beans, fatty fishes. These have all been seen in clinical studies to actually lower our risk factors for breast cancer.
And always water, right? Lots of water.
Water
and
hydration is
sleep.
huge because our cells use that to actually help your body heal. And there's functionings and cycles in our cells that actually help the cells to recover from damage, which is ultimately a lot of times what leads to cancer, for your body to get better. Definitely.
At what age should we start worrying about this? I mean, obviously we should always be healthy throughout our entire life, but is there a certain age that you talk about these tips with clients?
Yeah, so that's a great question, because for women where they have first-degree families, where they're having early cancers, like in their 20s or 30s even, or you have the BRCA1 or 2 gene, or you have other genetic factors that we know are linked to breast cancer high risk, you want to be talking to your doctor much earlier. So for example, if you have a family member who had breast cancer in their 20s, you actually want to be talking much earlier than the age that person was. So even in your late teens or early 20s, you want to start having those conversations. But for people where they don't have high risk, like radiation exposure, first-degree family members, BRCA genes, or other genes that are high risk, and some other risk factors that you could talk to your doctor about. But really, for the average person with the average risk, you want to start looking at screening around age 40. Talk to your doctor about getting mammograms every 1 to 2 years, starting at that age. And then if you have very dense breast tissue, you may want to talk about, do I need additional ultrasound or breast MRIs associated with the mammogram? And a lot of questions that I get from older patients are, when do I stop getting mammograms?
Sure.
And it used to be that we would think people would stop around 74, 75, but now that people are living much longer, we actually are talking to patients about continuing to screen as long as their life expectancy is greater than 10 years. So if you're 80 years old, but you're a very healthy young 80 years old, then you may want to talk to your doctor about, okay, well, if I'm expected to live till I'm 95 or 100, should I still be screening? Because most of the time, if you're expected to live longer than 10 more years, we still will want to keep an eye on that.
A young 80 years old. Here's hoping.
Yes. I know, always.
For more information, go to wisdominwellness.com. Thanks so much for being with us, doctor, sharing these tips with us this morning.
Pleasure to be here. Thank you.
Thank you.